Okay, so on kind of a different subject here, I'm going to be talking about bicycling and related to some urologic issues. And because we're in Jackson, I wanted to have a little bit of a horse theme here. So I want to know if bicycling will indeed make you a stallion or a gelding. Disclosures, I don't have any that are relevant to this other than the fact that I like biking. So why do we actually care about this at all? Well, there are lots of cyclists. We know that it's a super efficient way of transportation. It's good for cardiovascular health. It's low impact, inexpensive, et cetera, et cetera. But in 1 year, you can see there's plenty of ER visits, hospital admissions, and even deaths. And I want to remind everyone that there is a very robust and growing body of literature that supports that cardiovascular disease and ED have a strong relationship, that reversal of risk factors for cardiovascular disease improve erectile health and function. There are even randomized studies that show that improvement of some of these risk factors can improve or even ameliorate erectile dysfunction, depending on how bad it is. So I want to keep that in mind as we go through this talk. So why did this even really become an issue in the modern era? Well, here's a quote from Dr. Goldstein, and those of you who know him can see why he would make a sort of a bold quote like this. Men should never ride bicycles. Riding should be banned and outlawed. It's the most irrational form of exercise I could ever bring to discussion. So this was published in Bicycling Magazine in 1997. I should point out that I think both of his kids have now had hip surgery from playing hockey, so he should keep that in mind also. But that's irrelevant. He did not make this statement based on any particular published data. Because I talk to him all the time, and I've given him crap about this a lot. Yes, right. Yeah. This is well known. Yeah, public knowledge. Yes, right. This is not a HIPAA thing. I don't do hip surgery. Okay, so, but this is not a new thing. Dr. Goldstein was not the first to say this. Hippocrates actually had a statement about this, talking about the Scythians. And I'm not going to read this entire quote, but basically what he said is that the rich Scythians who rode on horseback, they became very, very impotent. They were fat and lazy, and they rode around, and they really just stopped having intercourse, whereas the poor Scythians who had access to less food and were weaker, they had to do all the walking, and they seemed to do just fine. So maybe it was the sitting on the saddle all the time that caused these issues. But coming a little more modern, this is still an old catalog picture looking at bicycle seats, and you can see that these seats with their little pelvic models here, they're trying to keep pressure off of some of the sensitive soft tissue, and they state that here. Especially that left middle one. So, coming back to the more modern era. This started really with some case reports, and these are from the 80s, early 90s. First one was a rider who had penile numbness after 2 days, a long ride, and then that resolved after the ride, after a while. Another one where a patient started to ride a stationary bike, began having numbness in ED, which resolved when he stopped. Third case, someone who switched to a triathlon bars, which are bars that kind of pitch you forward on the bike, and then he went back to drop bars, and this all resolved. And the last one was someone who sustained a perineal injury in a motor vehicle accident. Then when he returned to cycling, also using these triathlon bars, he began to have these symptoms, which resolved when he backed off of that. Okay, cohort studies. This was a great survey that was done during this race, and this is the kind of race I think that could only really happen in Scandinavia. This is a one-day race in Norway that, as far as I can tell, was going on as recently as 2006, 540 kilometers in one ride. It takes between 16 and 37 hours to do. And these riders were polled afterwards. There was actually men and women, although I'm just talking about the men here. 13% had erectile dysfunction after the ride, and 7% of those lasted over a week. Only 2 of the riders had ED that did not have antecedent numbness, and that ED correlated with having ED after previous attempts like this, though none of the subjects had ED if these long rides were less than 100 miles. So these are people doing very long mileage. So there was a survey done of cycling clubs in the United States, very high number of respondents, and they asked these questions. You can see them listed here: IEF as a validated instrument looking for ED, their medical history, some cycling-related variables, and those variables really came, and this grew out of Goldstein's statement, but from an ABC 2020 episode in 1998 where they suggested maybe lower miles or having a seat angle that's tipped down, not using aero bars, et cetera. So they used those parameters to ask, so what things were associated with ED? Well, age, not surprisingly. Those who were greater than 50 had a higher percentage chance of ED and compared to those younger. But years of cycling actually was not predictive, or at least it wasn't predictive as you might think. Those who had a longer history of cycling had less ED than those who had a shorter history. So due to some complaints from these harbor police, so these are guys who are riding around bicycles all the time doing their cop duties, the National Institutes for Occupational Safety sort of started a study here. And they actually did 3 of them, and we're going to go to all 3 of these. So in the first one, they looked at parameters such as saddle pressure. They did a hormone analysis. They did another IEF. And they did a Regiscan. I'll explain that in a second, as well as a work health questionnaire. Most of these guys did say they had occasional numbness during their day. This is what a Regiscan looks like. This is a device that's worn at night, and it records the number of erections and how long they last really during REM sleep. What did they find in the study? Well, no one actually had ED. In the Regiscan, they did show that the sleep time erections were decreased in the cycling group, and the sleep erection events, there wasn't a difference. They did find a correlation, unsurprisingly, between body weight and the saddle nose pressure. So they wanted to switch to saddles that really didn't have a nose based on this first saddle and on the first study, and some of the cops were really resistant to this because they thought, well, maybe they'll get more pressure in their hands or on their feet, and maybe there's going to be balance issues if they use these non-traditional saddles. So this study was actually not looking at ED specifically, although they did include it in their analysis. So they were looking at pressures on the upper extremity, lower extremity, on stationary bikes with different saddle designs, and they made an assumption that the anterior pressure, or pressure anterior to the ischial tuberosities, really correlated to perineal pressure and a higher risk for ED. So that was their assumption. And this was the pressure mapping, and you can see that in this lower left, that's a very traditional saddle, and you can see a lot of pressure in the front, and much less pressure in these non-traditional saddles where all of the pressure is moved to the posterior. In the traditional saddles, there was twice the perineal pressure as in the other saddles. There was not an increase in hand or pedal pressures, regardless of saddle design, and so these cops did adopt these new saddles. And then there was a follow-up, the last study, with 90 subjects, 6-month follow-up, again looking at IEF, saddle pressures, back to the Regiscan and biothesiometry. And what did they find? Well, the IEF really no difference at all between traditional and noseless. You can see most of the subjects had 30 out of 30 on their IEF, which is the highest score. Vibrotactile sensitivity, a little less on those who use the non-traditional, less on those who use the traditional saddle. Perineal pressure more on those who use the traditional saddle. But the number of nocturnal erections by Regiscan, the same. Erection duration, the same. Now, is that really a good population that we can use to make assumptions about this? Maybe. I mean, these guys are wearing utility belts. They tend to be bigger, heavier guys, and they ride in a very upright position, and they're on their bikes a lot, like 5.5 hours a day. Even when they're not riding, they're sort of leaning against walls or poles, and they have a very slow riding style unless they're chasing someone, and then in which case they go pretty quick. That may not be how most recreational riders ride. And you can see in biomechanical studies that if you ride in an upright position, you put a lot of weight on posteriorly, but as you get into the drops, which are the curved parts of a handlebar, like you can see Dr. Manga here on the right side riding his bike, zipping along, the pressure actually starts coming off the saddle and they start to float above the saddle, so pressures decrease as you pitch your weight forward onto the drops at higher power outputs. So what's the theory behind ED? So there's really a couple related. There are, of course, arteries in this area. You can see these listed, and the pudendal nerve. And these are thought to be squished, and they can be squished right in the midline between the seat and the pubic symphysis, or slightly lateral to this in Alcock's canal, medial to the ischial rami. And there is some evidence of this. There's both CT images and MRI images that were actually done from Utah that demonstrate that the greatest compression of the internal pudendal when leaning forward and cutout saddles, which I'll come back to later, actually make no difference. This has more to do with the rider position. And this area below the pubic symphysis is the maximal compressive area. So here's a picture of how they did this study. You can see this gantry on the top, and then they have this saddle that's pushed into the perineum, and they slide them into the machine. And this is what you see. So in that white bold arrow, that's the cavernosal space, and then you can see with the dotted arrow, that's the bottom of the pubic symphysis, and you can see once loaded there on the right side, this all gets pretty squished. So trying to look at blood flow a little more directly. This was a nice study, and I'm really sorry that Dr. Mulhall is not here yet, because I think he was actually a fellow around the time this was being done. They looked at corporal artery flow after injection of a vasoactive agent with patients sitting. They weren't cycling, but they were on a static saddle with pressure. And so these were static forces only, and this is a picture of what this looks like, this poor guy having to do this ultrasound in this kind of incredibly awkward position. But here's what they found. If you're sitting upright on the edge of the bed, so there's no pressure in the perineum, then the flow is pretty good. Now this flow might look a little low, but these subjects were all patients who had ED that they themselves attributed to cycling. So these are not sort of normal control subjects. But then if they straddle the stationary bike that's fitted with a narrow saddle and do the same thing, well, that flow goes dramatically down. But then when they have a saddle that's non-traditional, one that's just on the butt cheeks, and they're sitting on it, flow goes essentially back to baseline. So what about cutout saddles? Based on this 1997 statement, there spawned a whole industry of saddles that were purported to put less pressure in the perineum by removing material in some way or another from the central portion of the saddle. So that's the theory, is you get rid of that pressure, and so things get better. But in practice, it looks like it doesn't really work that way, and might even make it worse, because there is a decreased surface area, and so you concentrate the pressure just lateral to the center, which is actually where the vessels and the nerves are. And there are a couple of studies showing this, that there's increased pressure over the perineal vessels, and then increased rates of ED if you compare them to conventional saddles. Now, what about other parameters? Well, you'd think maybe a gel saddle that seems pretty comfortable. Would that help? Well, no. There's actually less oxygenation using a padded saddle versus one that has no padding whatsoever. And this is true in all positions. More upright angle generally is more oxygenation. So if you're 90 degrees versus 60 degrees versus 30 degrees, there becomes less oxygenation, except for in pro riders where this is the opposite. Are there other cycling attributes that might contribute? Well, body weight is probably the most important, followed by tilt, followed by flexibility. Now, this is a sheet from one of the big bike manufacturers, Specialized, and they were really the first to get on this idea, offering not only different width of saddles to be able to match the width between the ischial tuberosities, but having these cutouts. And their claim is that with this combination of the different widths that are more suited for individuals, as well as the cutout, they could ameliorate some of these issues. Now, I will point out that looking at that picture in the middle, it actually looks like that saddle should cause more problems if you see even the way they drew it, but we'll leave that aside. And this is how they measure it. So this device on the right is literally called the assometer. And this is available in the bike shops that sell Specialized products, and you do a deep squat onto this pad, and then you measure the imprints, the distance between the imprints, to decide what is your What is your pressure? So is this how you ride a bicycle? Is this what your legs look like when you're riding a bike? It may not be the most accurate thing for determining what this is going to be like when you get on the bike. And here's why. So if you look at a pelvis, and it's either in a posterior tilt or neutral, you're pretty much on the ischial tuberosities. But the moment you start to tilt forward and you get that anterior tilt, you move off of the ischial tuberosities onto the rami. So here would be pressure mapping, looking at this, at least in a static sense. In a more upright position, there's less of this anterior pressure, and as you move forward, it becomes more. Again, it's a pity that Mulhall's not here, because this is the Irish winner of the 1987 Tour de France, Stephen Roche, on the left. And you can see his pelvis is actually pretty much straight up, and he rounds his back. It's called a type B back, whereas Bradley Wiggins, who won in 2012, I think, he has tilted his entire pelvis forward to adopt this aerodynamic position. So just want to remind everyone of this part, that cardiovascular risk is significant. It's really a huge contributor to erectile dysfunction. So what are the general recommendations? Well, cardiovascular benefits are important for general and genital health. It's important to get a good fitting if you're going to be a biker. You want to choose a saddle that allows most of your pressure to be on the rami, not really in the center. Cutouts are not helpful and actually might be detrimental. The data on padding is actually mixed, but probably not favorable. And you want a slight downward tilt on the saddle. I'm not going to present that data, but we can talk about it later. If you have numbness, you should stand up occasionally, give things a break. If you really want to fully minimize these, get a recumbent bike, something you sit back on so there's no pressure at all. Numbness is not necessarily dangerous, it's actually common, but the majority cases of ED are associated with antecedent numbness, so it's probably worth thinking about. So coming back to this quote of Hippocrates, so is it really a saddle? Maybe it's the fact that the rich Scythians, they had maybe a richer diet. Maybe they were a little too fat, a little too squat, a little too sedentary. And I would suggest that that might have more to do with their ED than the saddle itself. I'll leave you with this slide, how to improve your year. And with that, I thank you very much for your attention.